This video has been provided by the Johns Hopkins Home Care Group and the Johns Hopkins Division of Infectious Diseases. Thank you in advance for watching this video. This video will be presented in 11 sections. Introduction, how to get started, hand hygiene, prepare a clean workspace, gather supplies, arrange supplies, prepare supplies, scrub the hub, pulse flush, ready to connect, disconnect and flush. Your medical provider has prescribed an IV medication for you that you can safely take in your home. Your IV medication comes in a pressurized pump called an Eclipse ball. This video will provide you with the instructions on how to infuse or administer your medication when needed. Your nurse or pharmacist will also give you special instructions for your medication. Please watch this video as many times as you need. If you have a caregiver, family member, or a friend helping you, please have them watch it as well. How to get started. Your nurse will tell you how to store your infusion medication. This also can be found on your medication label and on your pharmacy prescription. Your nurse will also tell you when to take your medication and how often. If your Eclipse ball is refrigerated, we recommend that you remove one Eclipse ball from the refrigerator at least 2 hours before it's time to infuse so that it can get to room temperature. If you forget to remove the Eclipse ball ahead of time, it's okay. The cold medication will not hurt you, but the cold fluid may feel a bit uncomfortable while it's infusing, and it may take a little bit longer to finish infusing. Hand hygiene. Now, the first thing to do is to make sure that you have a clean work surface and clean hands. So let's talk about how we properly clean our hands. If your hands are visibly dirty, wash your hands using soap and warm water for at least 20 seconds. Dry with a clean paper towel. If your hands are not visibly dirty, you can use an alcohol-based hand sanitizer. Place a dime-sized amount of sanitizer in the palm of your hands. Rub your hands together vigorously for at least 20 seconds until your hands are dry. Make sure you rub between your fingers and the backs of your hands. Never blow on your hands or wave or wipe them to speed up the drying. You will wash or sanitize your hands several times throughout this process. Whether you wash or use hand sanitizer, remember that it is always important to wash for a whole 20 seconds each time. Prepare a clean workspace. Before each infusion, it is important to find a clean, dry, hard work surface to set up your medication and supplies. You can place the provided SASH placemat on the top of the selected work surface. Wipe the surface and the SASH placemat down with household cleaning agent like Clorox wipes or Lysol and a paper towel or an alcohol pad and allow it to dry. Now, wash or sanitize your hands again for a full 20 seconds, the same way we did the first time. The next step would be to gather your supplies. Your home infusion agency should provide these supplies. If you are missing any supplies, please call your home infusion agency. You will need 2 pre-filled normal saline syringes, 1 pre-filled heparin syringe if prescribed by your provider, 1 medication-filled Eclipse ball, and 4 to 5 alcohol pads. Now arrange your supplies on your clean SASH placemat according to the picture. Place a saline syringe over each S. Place your medication ball over the A. If flushing with heparin is prescribed, then place a heparin syringe over the H. Place the alcohol pads in their place on the board. The S is for saline. The A is for administer or antibiotic. The second S is for saline. And the H is for heparin, if needed. You will also need the most recent medication orders from your home infusion provider. Now, check the label on the Eclipse ball and compare it to your prescription. It is important to always check the medication label to make sure that your name is correct, the medication and the dose of medicine is correct, and that it matches what is on the prescription. Look at the expiration date or the do not use after date on the medication label. If any of this information is incorrect, stop and call your infusion pharmacy immediately. Now, Wash or sanitize your hands. 20 seconds, remember? If sanitizing, you want to always get a good amount in your palm, then rub until dry. Good job! Now we are ready to prepare our supplies. Start with the first saline syringe. It looks like this. Remove the protective end cap on the syringe and place the cap flat side down on the table. You will need to replace the cap on the syringe later, so you want to make sure that inside of the cap doesn't touch anything or get dirty. Hold the syringe with the end up and plunger at the bottom. Pull back on the syringe plunger slightly to break the seal on the syringe. You will be able to see the tiny air bubble in the syringe. Slowly push the plunger up to let that tiny air bubble out. Once the air is removed, pick up the cap from the table and replace the cap on the end of the syringe. Place the syringe on the sash mat on the first S. Repeat this step for the other syringes on your board. Once you have done this, you are ready to move to the next step. Inspect the Eclipse ball for any leakage, damage, or discoloration. The medication should be clear, not cloudy. Remove any paper tabs that may be holding the Eclipse ball tubing together. Make sure the clamp on the Eclipse ball tubing stays closed until you are ready to begin the infusion. Good job! Now it's almost time to connect and administer your medication. But before we do, we must scrub the hub and flush the IV line with saline. But can you guess what comes first? You got it! Wash or sanitize your hands. Remember to wash or rub for a full 20 seconds. We will then clean the end cap or scrub the hub on your IV line. You may be wondering, what's an end cap? The end cap protects your IV line from bacteria. It is very important to keep the end cap clean to prevent infection. This one shown here is in blue, but your end cap could be another color depending on your home infusion provider. You can ask your nurse what color your end cap is. No matter the color, remember, it is very important to clean. To clean the end of your line, we will scrub the hub by using the alcohol pad located right before the S on your sash placemat. Remove the outer wrapping to expose the alcohol square. Wrap the alcohol square over and around the sides of the hub. Scrub the hub with the alcohol square for at least 15 seconds. Throw the used alcohol square in the trash. Once you have cleaned the hub, you do not want to get it dirty by allowing it to sit on a surface or hang loose. But if you do, it's okay. You will just need to wash your hands and re-clean again with a new alcohol square. Ready to flush? We will now flush the IV line with saline. Now, while keeping the end cap or hub clean in one hand, grasp the saline syringe with your other hand. Remove the cover that is on the saline syringe and attach the syringe to the hub of the IV line by screwing the syringe to the hub in a push and twist motion, like putting a key in an ignition. Good! Now that you have connected the syringe, open the clamp on your IV line and slowly push about 1 to 2 milliliters of the medication in at a time. Stop and push 1 to 2 milliliters more. Stop and push in a little bit more. Keep doing this until all the syringe is empty. Flushing this way each time helps keep your IV line from getting clogged. If you are unable to flush your line or find that it takes a lot of effort to push in the fluid from the syringe, double check to make sure that the clamp on your IV line is open. If your clamp is open and you still have difficulty, stop and call your infusion provider. Once you have emptied the syringe, you should disconnect the syringe from your IV line and throw it away. Be careful to disconnect the empty syringe only. Remember, you do not want to remove the hub from your IV line. You are ready to connect your Eclipse ball to your IV line. But before you do, double check to make sure that you have answered the 3 questions found across the top of your sash board. Did you check the prescription? Did you check the expiration date or the do not use after date? And did you wash your hands? Go ahead. Wash or sanitize your hands for a full 20 seconds. Now, You must scrub the hub again for at least 15 seconds. Do you remember what else to do? Use the next alcohol pad on your sash board, the one before the A. Unwrap the pad and wrap the alcohol square around and over the hub while applying friction, just the same way we did before. Remember, we call this scrubbing the hub. When done, throw out the used alcohol square. Now, hold the clean hub in one hand and keep it clean. With your other hand, locate the end of the Eclipse ball tubing and remove the protective cap on the end of the tubing. Connect the exposed end of the Eclipse ball tubing to your IV line by using the same push and twist motion you used before to screw the saline syringe onto the hub. Once you have secured the connection, open the clamp on the Eclipse ball tubing. Your infusion has now started. Good job! Watch the Eclipse ball during the infusion. The Eclipse ball will begin to slowly collapse as the medication infuses. The total infusion time will be written in the prescription order. Please ask your nurse or pharmacist if you are concerned that the infusion is not infusing within the prescribed time. You will know that your infusion is complete when you can see the balloon inside the ball has deflated around the cylinder in the center of the ball. It is very important to never disconnect the ball before the time prescribed for the infusion. If it looks like there may be some fluid in the ball after the prescribed time, then allow it to infuse for another 5 minutes. If there is no change after 5 minutes, then the infusion is complete. Once the infusion is complete, close the clamps on the Eclipse ball tubing. Congratulations! Your infusion is complete, and now we need to disconnect and flush. Before you disconnect the Eclipse ball tubing from your IV line, make sure to wash or sanitize your hands for a full 20 seconds. To disconnect, hold your IV line at the end cap with one hand and unscrew the Eclipse ball tubing with the other, counterclockwise. Be sure you do not remove the end cap in this process. Throw the used Eclipse ball device away. Go back to your sash placemat. It is now time to flush your IV line again, using the saline syringe on the second S on your sash mat. You will repeat the same flushing steps you used at the beginning of your infusion. Do you remember? Always wash or sanitize your hands for a full 20 seconds. Now, scrub the hub of your catheter for 15 seconds with an alcohol pad from your sash board, the one before the second S. Remember, once you have cleaned the hub, you do not want anything to touch it. If the hub falls from your hands after you have cleaned it, simply clean it again with a new clean alcohol pad. Be sure to hold the IV line and hub, but do not touch the tip or the sides with your fingers. With your free hand, pick up the saline syringe located on the second S of your sash board. Remove the cap from the saline syringe and attach it to the hub on your line, which should still be in your other hand. To attach the syringe, you will use a push and twist motion, like putting a key into an ignition. Once you have connected the syringe, open the clamp on your IV line and slowly push about 1 to 2 milliliters of the medication in at a time. Stop and push 1 to 2 milliliters more. Stop and push in a little bit more. Keep doing this until all the syringe is empty. If you are unable to flush your line or find that it takes a lot of effort to push in the fluid from the syringe, double check to make sure that the clamp on your IV line is open. If your clamp is open and you still have difficulty, stop and call your infusion provider. Once you have emptied the syringe, you should disconnect the syringe from your IV line and throw it away. Be careful to disconnect the empty syringe only. You do not want to remove the end cap from your IV line. The final step of the sash placemat is the H for heparin. Heparin is a blood thinner used to keep your IV line from clotting with blood. Depending on the type of IV line you have, you may not be required to use heparin. Please ask your nurse or pharmacist for further direction. Before using your heparin, use the final alcohol pad before the H to scrub the hub for 15 seconds. Attach the heparin syringe to the hub and flush as you did with the saline using the stop and push method. Remove the heparin syringe, being careful not to remove your hub. Close the clamp on your IV line. wash, or sanitize your hands. Congratulations! You have successfully infused your medication. Great job!